As a medicine intern, you spend most of the time in the ward. In my program, we spend 5 months in the ward. And as a ward intern, you will spend a lot of time admitting new patient or getting new patient, which could be a transfer from the ICU. And before you go and talk to the patient, it's always good to pre-round on the patient. And I have a template that I have developed myself that I use when I'm taking on a new patient. And you can find the download link to this template on the description below, but I want to walk you guys through the template myself. This is how the template looks like in its entirety, and once I fill up this template for day 1, I will continue to use this template on day 2, day 3, and so on. I'll talk about it more. So let's get started. So on the top, I have their name, age, what room they are in, and what's their medical record number. The other information I really like is the hospital entry date, because a lot of times patients are in hospital for many days and you lose track of when they came to the hospital. So I always like to be mindful of when they came into the hospital. And the other reason is that way I'm prioritizing my discharge as well. If someone has been in hospital for too long, then at that time I'm really trying to think, why is this patient not being discharged and what can I do to make the patient discharged sooner. The other really important stuff I never like to forget is the court status of the patient. I always like to personally verify and write it down here. And the other information is the next of kin, their name, and I write their phone number down too. Just in case something happens, I don't have to go and dig into the EMR to find the number down. I can just look it here from my template myself. Now this rest of the template we're going to discuss in terms of admitting a patient from the ED. So one, I like to know the reason for ED visit. So let's say, for example, a patient may be admitted for pneumonia, but I want to know why exactly they came into the emergency department. Did they come in because they were short of breath? Did they come in because they had a fever? Did they come in because they were just not feeling well? And the reason I like to know this is because at the time of the discharge, there should be some resolution of the reason for ED visit. I have a personal example myself. I had a patient came in with shortness of breath to the emergency department. He had some fever, leukocytosis as well. We treated him for pneumonia. His fever resolved, his leukocytosis resolved, but he was persistently complaining of shortness of breath. He told me that his shortness of breath has not essentially improved since he came in. And at that time, we had to dig in deeper to find out why he was being persistently short of breath. At the end, we just decided that he was a big overweight guy, and that was leading to his persistent shortness of breath, and we ended up discharging him anyways. But that's the reason I like to know the exact reason for ED visit, because this has to be addressed before a patient is being discharged. Now the other tab I have is this ED course / pre-hospital visit. I briefly like to write down what happened before the guy came into the hospital. For example, they may had fever for 5 days. They may had bloody bowel movement for 5 days. It's brief, it's not too extensive, but just something to keep in mind of what was going on. The next thing I like to write in my template is just the labs and vitals in the ED. If they are normal, I usually leave it blank because, as you can think, it takes a lot of time to fill these things up. So here, let's go to the vitals tab. Temperature, if they are febrile, I write the temperature. Otherwise, I just put a big OK. If everything is normal, I just put a big OK. That tells me that the vitals normal. If anything is abnormal, I write down the abnormal thing. Now let's go to the lab. So I have this like basic electrolyte. One of the important things here to keep in mind is this creatinine. A lot of old patients tend to have chronic kidney disease, so I especially like to pay attention to the creatinine at the time of ED visit. And then I write their baseline creatinine as well if the ED creatinine is elevated. That tells me how the creatinine is now compared to the past. The other one is just the CBC. And again, in the CBC, the hemoglobin, I find it to be more important because a lot of patients are anemic. So whenever I find that they have anemia, I like to write the baseline hemoglobin on top, because that would tell you whether you need to work up this anemia or not. So let's say that a patient comes in with hemoglobin of 10, and their baseline hemoglobin is always around 9 or 10, then you do not need to work up this anemia at all. For the most part, you can just say it's chronic and you can leave it for the outpatient doctor to work it up. But let's say their outpatient hemoglobin was already always 14, 15, 14, 15, and now they come in with a hemoglobin of 10, then you need to address this drop in hemoglobin. Again, I pay more attention to creatinine and hemoglobin because chronic kidney disease and anemia are more common. The other one, white count, platelets is good to keep in mind. AST, ALT would be ordered in some patient, not in all patient. There's DBD, TBD, ALK-Phos, and if there's other lab, some of them could be like a flu swab. In some patient, you'll get INR, just other labs. And here I wrote down other meds if they give any meds in the ED. I like to write them down here. The antibiotics, I write it on the ABX, any antibiotic they give in the ED, and other medication they give in the ED. It's good to keep track of what medications we are giving patient in the ED, because that is the main treatment we're providing someone in the hospital, is we're giving them medications. So I like to be mindful of what medications have we given the patient. And now here are some other labs and other stuff we usually get in the ED. One is troponin. Old people who come in with abdominal pain too, that could be a mimic for their chest pain. So troponin is usually ordered. LA is for lactic acid. UA is for urinalysis. CXR is for chest x-ray. EKG is for EKG. CT, kind of short to write down here, but if there's anything grossly abnormal in the CT, I write it down here. Antibiotics, what antibiotic was given in the ED, and fluid, like 1 liter normal saline, 2 liter normal saline, or whatever fluid was given in the ED. So once I fill out this template, I usually have a really good idea of what happened in the ED. And then down below, I have this hospital course, and a hospital course is usually, because I told you that this template, I use it on a daily basis. So let's say the patient has been with me for 10 days, and he had an endoscopy done on day 2, then I'll write down that endoscopy was done. I write the exact day, like March 31st or something like that. Let's say the patient was intubated and extubated, then I'll write the date that the patient was intubated, the date that the patient was extubated. It's usually only the important things that happen in the hospital, not some routine regular thing. Let's say if the patient just had a headache, I give them Tylenol and the headache went away. I would not write the headache here because that was not important. So important thing that happened in the hospital, I usually write it here. Then the next section I have is past medical history. And the past medical history, so usually the way the system works in my hospital is that whenever I'm getting a new patient from the ED resident, the ED attending, or the PA from the ED would give sign out to my senior, and the senior signs out to me. So when the senior is telling me about the patient, he or she would usually tell me the past medical history, and I will just write it all down here when the senior is telling it to me. And sometimes when I'm going through the chart, I like to write all the past medical history as well that is new and not told to me by the senior. The reason being that sometimes around the time of discharge, and you're carrying 10 patients, it's easy to confuse who had diabetes, who had chronic kidney disease, who had AFib, especially if that's not the main thing you're managing, the patient just happens to have them. It's easy to forget. So I like to have it in my template that what past medical history they had. The other one is allergies. Now here are a couple of important things I like to know, but let's talk about the rest of the template in a different video.